You're watching CW Montana. This is the MTN 9 o'clock news.
Good evening and thanks for joining us tonight. I'm Russ Riesinger. The nation's hospitals, the front line in the battle against the coronavirus, are in line to get more than $50 billion from Congress's new CARES Act to help respond to the pandemic. But so far, those dollars have been slow to arrive. And now a new study reveals hospitals that primarily serve the poor got the smallest share of the money. Q2's Jay Cohn gets down to the bottom of it in tonight's Montana Rebound Report.
The study by the Kaiser Family Foundation included more than 4,500 hospitals nationwide. The bottom line, Congress based the CARES Act financial help on a hospital's revenue, not a hospital's need. The result, a sharp disparity among hospitals serving a majority of private insurance patients versus those with a high percentage of uninsured patients. Boiled down to per-bed costs, hospitals with a high percentage of private payees received as much as $44,000 per bed, while hospitals doing more charity work and serving as teaching facilities received less than half of that, $20,000 per bed. In Montana, it's a little different scenario, but still a case where it appears the CARES Act dollars may have missed the mark.
We had the lowest distribution of this last run of any state in the country. And we also happen to have the lowest incidence of disease. So we took on a lot of expense. We made major adjustments to operations to bring in the best approaches in public health, and we were successful in keeping the disease out of this state, but it didn't come without a cost. And unfortunately, the flow of dollars to date really has penalized highly efficient states like Montana.
When hospitals canceled all elective surgery to focus on preparing for COVID-19, their costs went up while revenue dried up.
Pre-CARES Act dollars, our loss was $13.44 million for the first 5 months of the year. And then the CARES Act dollars we received in April, we did recognize as income, and that was $10.64 million. So our overall loss now year to date through May, and your timing's perfect because we truly just have the financials through May, so fairly timely information, would be a $2.8 million loss at this point of the year.
Meanwhile, just down the street at Billings Clinic, the books here have been in the red for 3 months in a row. They're hoping that this month, the month of June, they'll finally make it back into the black. CEO Scott Elner says the financial impact of COVID-19 hit hard.
We've determined we've lost about $42 million in net revenue, which was a significant impact due to canceling of elective surgeries, shutting down our clinics, and really figuring out at the same time that we wanted to keep people employed. So we did not do any layoffs or furloughs.
In April, the clinic received $14 million in CARES Act funds, which helped, but that covers only about 1/3 of the clinic's cost. Both Elner and Pelagi credit the CARES Act dollars in helping both hospitals avoid layoffs or furloughs. In fact, Elner told us he was surprised at how fast the federal funds arrived. Looking forward, though, fingers are crossed as no one really knows for sure what's next. Rich Rasmussen at the Montana Hospital Association says buckle up for some tough days ahead.
This is a marathon. It's not a sprint. It would be very different if we had a vaccine in place, and we don't. And we know, too, it's, at the same time that we have the likelihood of the COVID-19 surging in the fall, it's going to come the same time as we have traditional flu. So we'll have this confluence of infectious diseases potentially hitting us at the same time.
In Billings, I'm Jay Cohn reporting for MTN News.
Well, Jay says both hospitals face a big challenge to replace the lost revenue. You heard there, the clinic estimates its net revenue loss at $42 million. By comparison, for St. Vincent, that number is about $33 million, and both say they've been reimbursed for about 1/3 of their expenses. An update tonight as the Bullock administration has come under some criticism on its pace of dispersing federally funded aid to Montana businesses. The administration tells us another program to aid businesses should be unveiled as soon as next week. The program, in partnership with Montana banks, will help hard-hit businesses defer payments on their commercial loans. State Budget Director Tom Livers says the administration has been negotiating the details with banks for several weeks. The state will cover a yet to be determined amount of a business loan's cost using money from the $1.2 billion of federal funds that we were given. The Montana Bankers Association and the Montana Chamber of Commerce say that program will be a win-win proposition for banks and business customers. MTN News reported earlier this week that only 2.5% of those federal funds from Montana have been dispersed so far. Well, the Montana Department of Corrections may now have its first 2 cases of COVID-19 in a secured facility. 2 inmates at Montana Women's Prison here in Billings tested presumed positive for the virus Tuesday. Now, the inmate samples were transported to the state lab for confirmation. The Montana DOC is conducting sentinel testing of those who don't demonstrate active symptoms. The prison has implemented quarantine and isolation procedures. Riverstone Health is helping with contact tracing tied to the presumptive positive cases. After receiving the results, the department tested all 194 inmates and 48 staff members at the women's prison. Well, in addition to the 2 cases at the women's prison, Custer County is reporting its first confirmed case of COVID-19 tonight. That individual is now in isolation. And Bighorn County has added another positive case late this afternoon. We're also told that man is in his 30s and is now in the hospital. The man does have symptoms, and his case is not known to be associated with other clusters in Bighorn County. There are now 61 active cases across the state. 8 people are in the hospital. Final numbers after 3 days of testing are coming in from the Northern Cheyenne Reservation tonight. Health officials say 1,735 people were tested in Rosebud County. That total also includes 444 Bighorn County residents. Montana is scaling up COVID-19 testing to prioritize vulnerable populations and perform surveillance testing on tribal and also tourism communities. That's a message from Governor Bullock today. He said through community surveillance testing and contact tracing, Bighorn County found 43 new cases. One of those people died. Bullock said while there is no large community spread of COVID in Montana, 9 other states have seen a spike in COVID hospitalizations since Memorial Day. With more people coming into the state right now, Bullock says every visitor in Montana should continue to be vigilant and practice social distancing and good hygiene.
Of course, to continue this path, we all must remain committed. The virus is certainly still here with us, and we must keep learning how to live with it and to mitigate its spread.
Carbon County is one of those destination areas that the governor wants to focus on. Community testing will take place this Friday and Saturday in Red Lodge, and this is for anyone who wants to be tested, and they want to try and get as many people out as possible. It's a kickoff to the surveillance testing that they're going to be doing weekly for a percentage of frontline workers in the Red Lodge area. That would include people who work in restaurants and some other businesses to get a representative sample as the summer goes on and more tourists come to town.
As the summer begins and as tourists come to this area, we'll be able to adapt to where are infections happening. Are they happening in restaurants? Are they happening during some of our summer events? Are they happening in grocery stores? It'll enable us to kind of look at kind of micro areas in our community and possibly make small mitigation, toggling our mitigation to these areas as opposed to just shutting down large parts of our economy.
The community drive-through testing will take place again tomorrow and also on Saturday from 9 in the morning till 3 in the afternoon. That's at the Red Lodge High School parking lot on Chambers Avenue, and they're encouraging all permanent and summer residents in Carbon County to attend. They'll be using the self-swab technique where you just basically swab the front of your nose with a Q-tip, so it's quick and painless, and it'll give health officials a lot of important information. They hope that they can learn about just how prevalent COVID-19 is there in Carbon County. Well, President Trump attended a private fundraiser this evening after wrapping up a roundtable on police reform in Dallas, Texas. The president says he's working on an executive order on law enforcement. Meanwhile, Congress is putting forth its own proposals this week. Skylar Henry's at the White House with more.
During a roundtable discussion in Dallas, President Trump vowed to take executive action on police funding and use of force.
We must invest more energy and resources in police training and recruiting and community engagement. We have to respect our police. We have to take care of our police.
Ahead of the president's trip, his Democratic challenger, Joe Biden, accused him of avoiding meaningful conversations on race and dividing the country.
When he speaks and gives credibility to these racist folks out there, he breathes out, they come out from under the rocks.
We will not rest until the changes are made.
House Democrats announced their massive police reform proposal earlier this week, and Senate Republicans, led by South Carolina's Tim Scott, are expected to unveil theirs soon.
The ongoing protests have reignited debate about whether 10 U.S. Army bases named for Confederate leaders should be renamed.
President Trump doubled down on his opposition, tweeting Thursday, "Those that deny their history are doomed to repeat it." But military leaders and even some congressional Republicans say they're open to it.
If we're going to have bases throughout the United States, I think it should be with the names of individuals who fought for our country.
Meanwhile, in a video message to military students, the chairman of the Joint Chiefs of Staff, General Mark Milley, expressed regret for accompanying President Trump to St. John's Church last week.
That sparked a national debate about the role of the military in civil society. I should not have been there.
The administration received harsh criticism after federal officers cleared peaceful protesters from Lafayette Square ahead of that walk. Skyler Henry, CBS News, the White House.
President Trump announced he'll hold his first post-coronavirus campaign rally next Friday, June 19th in Tulsa. The president is getting backlash over that date, also known as Juneteenth, which is the oldest nationally celebrated commemoration of the ending of slavery here in the United States. Attendees who RSVP are being asked to acknowledge the risk of possible COVID-19 exposure. Well, the new numbers are out, and they say Yellowstone National Park is getting about half the visitors right now as it did on the same date a year ago. Park-wide, from June 1st to the 10th, Yellowstone recorded 54% of the number of vehicles entering as it did during the same 10 days in 2019. Wyoming entrances are doing a little better. Those gates register 67% of the number of vehicles they did in 2019. The Montana gates are at 49%. However, the raw numbers are much higher in Montana. More than 27,000 visitors entered through Montana compared to about 15,000 in Wyoming. The number of visitors expected to rise as campgrounds begin to open this coming Monday. Still to come on tonight's 9 o'clock news, despite the state's high unemployment numbers, some Montana businesses are struggling to find employees as they open back up. We'll explain in just a bit, but first, Bob McGuire's in with your full 7-day forecast.